Hello, my name's Dr. Rachel Moseley, and for the purposes of accessibility, I'm a white woman with long brown hair, sitting in an office with books and pictures on the wall and wearing blue. And today I'm going to be talking to you about autistic experiences of the menopause. So basically, in humans, maturing and developing is driven by changes in the hormonal systems, structures in the brain which basically control and regulate the release of hormones. And if you're someone with a female reproductive system, there are certain sensitive points where there are massive changes in these brain systems. And this, of course, results in massive changes in our experiences. So our physical appearance, our reproductive ability, our emotional, social development, and so forth. And interestingly, we're actually more vulnerable to mental and physical illness at these sensitive periods, and we're more impacted by things affecting our bodies, like stress. So one of these sensitive periods is the onset of menstruation, and we know that it's especially difficult for autistic people to transition through these changes. Another one of these transition periods is the menopause, and this is a time of life where women often experience physiological, cognitive, and emotional changes, and they often experience higher rates of physical and mental illness. So worryingly, we know very little about how autistic people cope with these changes, especially given that they're already vulnerable to physical and mental ill health and suicidality. I want to just very quickly explain what the menopause is, because it's a very poorly understood area, and it's historically been something, it's a bit of a taboo topic historically. So in a nutshell, when a person has a female reproductive system, they're born with a finite number of ovarian egg cells. These are depleted as we go through life naturally, just having periods, potentially having babies, but they actually also die over time. And when a person reaches a certain threshold of egg depletion, the ovaries no longer produce enough estrogen and progesterone to maintain a normal menstrual cycle. And at this point, the symptoms of the menopausal transition begin. So when people talk about the menopause, you'll often hear a lot about estrogen. This is the primary sex hormone in the female reproductive system. However, it has a much wider role in the body, such as in protecting bone health, and it's also important for the brain. So having lower levels of estrogen appears to affect neurotransmitters involved in mood, like serotonin, and serotonin is often associated with depression and anxiety. So serotonin levels seem to reduce along with estrogen, which makes sense as to why these symptoms therefore increase in menopause. Estrogen even plays a role in maintaining brain connections that are necessary for learning and memory, which is why there is such a huge impact on a person's mental state. Menopausal symptoms aren't only about estrogen depletion, but it seems that if you don't have enough estrogen in your body, you can't really, it dysregulates a whole host of hormones and neurotransmitters which are dependent and affected by estrogen. So ultimately, the person ends up swimming in a chemical soup with their hormones and brain chemicals very dysregulated. Though people talk about the menopause or menopause as a single thing, it's actually a process or transition. So the time when a person first starts having these symptoms is called the perimenopause. Basically, this is the period where hormone levels are dysregulated, the person's having symptoms, but they're still having periods, even if these are rare, infrequent. But when a person hasn't had a period for 12 consecutive months, we say that they've reached or passed the menopause, or that they're postmenopausal. They can still be having the same symptoms, however. So we conducted 2 studies looking at autistic experiences of the menopause, and the first of these was a real-time online focus group where we basically wanted to understand the state of existing knowledge around menopause in autism, how much information autistic participants felt was out there around the menopause, both in terms of what the average autistic person might know and what professionals like doctors would know about it. I'm going to focus on the second study today. And basically what we did was we took our focus group findings and devised an in-depth interview to find out more about autistic experiences of the menopause, symptoms experienced, the impact on their life, coping skills, what they felt was needed in terms of information and support. So what we did was we recruited participants via Facebook groups for autistic people, and we ended up with 17 participants. We then conducted semi-structured interviews, which were conducted in a way preferable to that participant. So either by Skype or Zoom, phone, online messenger, or as an online survey. And then we analysed the data using inductive thematic analysis, but also guided by principles around interpretive phenomenological analysis, which is essentially trying to understand a person's personal lived experience and how they make sense of that experience. So we interpreted a number of themes in our data, and there's a lot of resonance with the topics of this conference around life experiences of girls and women. I'm just going to focus here on the themes and sub-themes that were specific to the menopause. So the first theme was around the kind of journey or transition of our participants from growing up undiagnosed to gaining self-awareness of their autism. So our participants were all diagnosed in adulthood, and interestingly, the menopause was a significant or pivotal point for some of them, essentially because it was such a period of turmoil where the coping skills they developed fell apart, and through this they recognised and were assessed and diagnosed as autistic. Having recognised their autistic identity, some participants described anger, regret, disappointment at not having been diagnosed earlier, but overall self-awareness seemed to have a positive effect in terms of helping them be more self-compassionate and less self-critical. So participants felt that the menopause was a taboo subject, even with family and friends, and many of them felt that they lacked understanding of what to expect and also what it would actually feel like. They reflected on multiple levels of marginalisation that they inhabited as women, autistic women, and older women, who were, in the words of one participant, no longer relevant. Participants spoke about the positives of menopause, such as no longer having periods and being inspired to make positive or healthy life changes. However, there were also negative aspects to the menopause, with some participants perceiving it as a countdown to death, a suboptimal state of illness, where previously useful or enjoyable aspects of their neurodiversity henceforth became problematic. And this indeed leads us nicely onto the multiple impacts of menopause across the lifespan. So participants talked about physiological symptoms like hot flushes and insomnia, which could impact on their daily functioning, their self-esteem, for example, sweating out in public, being very self-conscious, and their mental health. And at a cognitive level, some participants reported worsening difficulties with memory, organisation, and attention. And for some of them, this had really severe repercussions on their work life and their ability to live independently. I should note that there was great variation in all of these multiple symptoms and impacts of menopause. Some participants only reported minor disruptions in any of these domains. Participants often reported that their coping strategies failed during menopause, and they were much more reactive to the environment. So to stress, for instance. And some reported extreme meltdowns, severe depression, more self-injury, and also suicide attempts. One participant said their emotions had been turned up a notch and they felt near psychotic. Some reported that they became less capable or less tolerant of social interaction, finding it much more exhausting to maintain the mask. And some found it nearly nearly impossible or very hard to express what was happening to them, such that they couldn't get support. And some experienced heightened sensory difficulties, or sensory difficulties that were entirely new and which had wide impacts on mental health, relationships, and daily functioning. So for some, this was very dramatic, as this participant describes sitting in a corner naked, rocking and bashing their head against the wall. And participants reminded us that menopause is situated in a general period of great change. You've got marriages possibly breaking down, partners possibly getting ill, parents getting ill or aging or dying, caring for children or children leaving home. So there's massive disruption in the environment anyway. And as previously noted, some found it very difficult to get information about the menopause or seek help. Not many of our participants were getting hormone replacement therapy, and there was a sense, as in our previous study, that doctors were perceived as naive on the topic of menopause and female autism, though some participants did have positive encounters. Asked whether self-awareness of one's autism was important when navigating menopause, some participants felt like it wouldn't have made a difference, but others felt like the knowledge would have helped them put coping strategies and support in place and be more self-compassionate when things got difficult. Some felt that menopause would have been more overwhelming and heightened the sense of being different when their body started changing in negative ways, and if they hadn't have known about their autism. In terms of what might have helped, participants really wished for the development of autism-specific resources, stories, symptom lists, video messages, narratives which they could use to identify with and navigate by. They also hoped for social support from autistic peers who, in the word of one participant, had walked the path back from Madland. While participants felt that healthcare practitioners needed to better understand autism and how being autistic might affect menopause, other professionals in the autism sector needed to understand something of the biological and psychological changes that occur in the aging process, enough to realize that normal chemical changes will be occurring during an autistic person's lifespan and need to be taken into account. So since we published this work, there's been one more study on autism and menopause, and it was fascinating to see very similar experiences being reported. Just like our participants, menopause was seen and experienced as more confusing and distressing due to lack of understanding about it. And these participants also responded a heightening of difficulties related to autism, and not knowing that they were autistic while undergoing the menopause added to their distress. This is very much a fledgling field in autism research, but it's a crucial one. These studies suggest that for some autistic people, menopause can be a very challenging time, and that for many, they approach it unprepared for this upheaval and for these changes. We know so little about autistic menopause and how to best support autistic people through it. And so we really need a lot more research to understand what's specific to autistic people in the menopausal experience, what might be different, what other symptoms they might experience or changes that they should be aware of, what factors might make things worse or protect them from the worst outcomes, and we need to develop resources to help. We really need to pay attention to menopause and later life stages if we're working to support longevity and quality of life in autistic people. So this is a vital research area. And I'm going to stop here, but thank you so much for listening. And my thanks go, of course, to my collaborators and to our brilliant participants. And I'll be happy to take some questions on this now.